Please state. Our stool operated as an assistant stool and what we're trying to accomplish with it. Okay. You guys can stop me at any time and ask questions. Okay. And I may use Dr. Todd for a couple of presentations.
Yeah, I got the email, don't worry.
Now, the other thing that we have, that we set the treat rooms up in, we have three rooms actually set up in a purely rear delivery setup, and then we have two that are set up with assistance delivery on the back cabinet, and then a left-right unit, and those are the two in front. So I don't know what type of concept. I know what concept you're used to. What kind of concept are you used to?
I'm used to a side unit and usually a tray over, but
like a post mount box here, and then it comes over the patient.
Like Tom, like that one with a bracket table on top.
yeah, this one over here. That works fine.
Yeah.
Is that what you mean?
Yeah, yeah. I mean that's just a different concept for it. It's an ellipse style unit, switches easily left to right.
Yeah.
And it's kind of given way to having the post box. It's a little cleaner.
Yeah.
That's why we've gone away from it. But okay, so we'll work our way through it now on our operator stool. Okay, because I don't know everything you're going to do, so I'll just assume that it's going to be generic, and we'll start from the.
Perfect.
Okay?
Perfect.
So there's two levers that I have on the stool itself. I've got a height adjustment, okay, and then the back lever is actually the lever that lets the backrest move, and it also lets the seat pan move forward. So I have my tilt. When I try to set an operator, I always will take the stool up as high as it'll go, and then I'll set that person all the way back so that you can see how I've got a negative cant on my legs. That's not how I want to set, but I want to get enough support on my hips and then my back, and I want to just kind of lean forward. You see how I lean forward a little bit? Okay. My seat tilt is good, and what that does is it helps take away pressure from your femoral artery so your legs don't fall asleep for longer procedures. But one of the things that we're really preaching and talking about is having your hips slightly above your knee. Okay? So now I'm in a decent position here where I'm going to lock this out at this point. Once I flip that down, it's now static. Okay? So I want to be a little bit higher than my knee. That may vary for some operators. I don't know if how you practice for a while. You can move to that a little bit if I'm not mistaken, right? So you know, the older schools had taught that your thighs are going to be parallel to the floor, and what they're really trying to preach and talk about now is that your torso is going to be perpendicular to your thighs, so that you can keep your arms at a very comfortable ergonomic position. Okay, so that's the idea with it. All right. So, are there any questions on that?